Thank you very much, John. And first of all, I want to thank Arthritis Ireland for the invitation to speak here today, and to say that I agree with what John has been saying. I think, like everybody, I know people affected by arthritis, and the difficulty that the condition is, particularly when it's serious, and how it disrupts careers. On the other hand, there are fantastic developments ongoing in relation to medical and drug advances, which are allowing people to live a quality of life which simply wasn't available to people, say, 20 years ago. So I think that the work that's been done by the Coalition and the whole concept of Fit for Work fits extremely well with the type of changes that the Department of Social Protection is undertaking at the moment. And I just want to talk a little bit about that. Since I became Minister for Social Protection just over 2 years ago, one of the statistics that I found very surprising in relation to social welfare was that something like 16% of the working age population in Ireland is on some kind of illness-related benefit or payment, covering illness benefit, disability payments, invalidity payments, and other payment supports. And in terms of a social welfare budget, which is about 20 billion, the spending on all of the payments directly related to illnesses is actually up around the 3 billion mark. So in a department which is under enormous pressure in the context of the Troika programme and the difficulties in the economy, this is a very, very important area. More importantly, though, we have to, I think, acknowledge that for people who have a difficulty in relation to some physical problem that they have, helping people to stay in work and to manage the condition is critical very often, not just to their being able to participate and to continue to participate in the world of work, but to their well-being, to their recovery, and to their management of the condition. And this is one of a number of conferences that I've taken part in, where a lot of the medical doctors, occupational health experts, people dealing in terms of psychology and psychiatry will say that being involved and staying involved in the workplace is enormously important to huge numbers of people, even if they have an ongoing condition, which means that they have to manage the condition and they need regular medical attention and regular therapies. And I think the challenge is to change to a workplace environment which is about wellness and well-being, from the old concept of, if you like, illness and the management of illness and conditions being in a different, if you like, a different compartment. We have a long-standing history in Ireland in relation, as other countries have, to the medical practitioner signing, if you like, an unfit for work note, and then that building up to becoming part of a long-term stay away from work, which ultimately is very debilitating for people. I see it myself over the years, leads people to withdraw from the workplace. Yes, they're happy to have income support from my department, but they're not happy to be ultimately becoming totally removed from active participation in work. And I think that it is critical that we look at the evidence that employment is good for people. It's good for both their mental and their physical health and well-being, and that the longer a person is away from work, the lower their chances of ever returning to work. Now, the Department of Social Protection, and since I've become Minister, we have actually made a number of significant changes. First of all, the false employment services, which would include services for people out of work, have moved to my department since January of 2012, and one of the biggest civil service reintegrations is ongoing in the Department of Social Protection, with about 900 false employees moving to social welfare and about 1,000 community welfare officers moving from the Department of Health and the HSE to social welfare. And I have to say, in the context of current discussions, that's all been done and managed under the Croke Park arrangements. And really, we have recently transformed 11 social welfare offices, particularly large offices around the country, into the new intro system, where when people go in, they get a centralised reception area, and we are in a position to deal with people in a much better way, and also then to concentrate not just ensuring people get a payment, but on assisting people in getting back to work. If they're unemployed, that means helping them back into education, to training, or into various community-based schemes like community employment. But it also means that if people have a recurring condition, or they've been out of work in terms of illness, that we are developing a number of schemes to assist people. And I just want to, and it's about focusing on ability as much as the traditional focus in social welfare insurance schemes in paying benefits on disability. So the numbers of people on the long-term illness schemes, on the disability schemes, it's actually increased over the last 10 years from 100,000 to 150,000 people. Now, part of that is probably impacted by the fact of the recession, and that people who are out of work for a long time, many people end up building problems in relation to stress and so on, and that they may move from job seekers to some kind of illness-related payment. So, looking at the changes in policy in the department, last year I brought in what many of you will be familiar with, which is a partial capacity benefit. It's been talked about in Ireland for a long time, but we actually brought it in last year, and the payment acknowledges that people may have some capacity to work depending on the level of their disability. And following medical confirmation of that fact, the person can take up employment or resume employment and and still retain part of their social welfare payment. And if their underlying condition recurs in a very difficult way, as it might, for instance, for people, say, diagnosed maybe in their 30s with a condition like MS or with other long-term conditions which are particularly difficult, but which can be managed, and where different people may have a different experience of how the management of the condition works out, that they can actually go back to work, which people want to do and tell me they want to do, but at the same time retain, if you like, a cushion of safety and reassurance in relationship to their connection to the Department of Social Welfare and their entitlement to a payment should the condition deteriorate, or should there be an interval when they need to be out of work. And I think it's important to understand that. So over 2,000 people have applied for this payment so far. And the claims are reviewed every 12 months. So the first cases to claim the benefit this year are now being medically reviewed. And in the light of what's emerging, I want to say we would value any particular examples that people have if they have been using this, employers, HR people or individuals, as to how they found this to work. It's a new departure for social protection in Ireland, so it's been quite demanding to set up this scheme, but we are reviewing the examples, and we would value your input or comments on where you think the scheme could be made more efficient, both from our point of view, but particularly from the point of view of the person who has the long-term condition. I also recently launched the Disability Activation Project, This is a project in relation to, again, people with disability or condition. It could be intellectual, it could be physical, in the Border, Midlands and Western region. And again, it's to help the department to determine how best to ensure that people with disabilities are enabled to avail of progression, education and employment opportunities. Just let me say, if getting a job at the moment is tough for people who are unemployed, it's even tougher for people who have a physical or an intellectual disability. And I'm really conscious of the fact that during the recession, that this is an area where we have to have, if you like, in this country, a principle of participation, that nobody should be locked out of participating in meaningful work simply because of, if you like, the vagary of the economic structures in relation to modern global employment practices. So one of the projects that's been undertaken in relation to the disability activation is being undertaken by the University of Limerick and Arthritis Ireland, and basically seeking to develop individualised occupational therapy programmes to enable people with arthritis to overcome the barriers they face in accessing, remaining or returning to work. And when I spoke at the previous conference just after I had become Minister, this was one of the issues. So I'm glad to say this project, I think the building of the project is underway as we speak. Another area which the Chief Medical Officer, the Chief Medical Advisor of the Department, Dr. Clement Leach, whom I think is well known to many of the people here, he has been developing a system called closed certification guidelines for use by GPs when people present for first time medical certification. These guidelines are intended to provide GPs with an evidence-based tool to achieve better health outcomes for their patients. They've been compiled for use in an Irish context with regard to evidence-based protocol on a range of medical conditions. Simply put, if you break your leg, the medical profession is able to predict broadly how long you may need to be out of work in that respect. There's a lot of evidence which Dr. Leach and his colleagues in the department have compiled over the years about the length of various types of illness and condition in terms of being out of work. The guidelines set out the expected duration of absence from work for a variety of acute common health problems and recovery periods from common uncomplicated surgical procedures. And the guidelines cover approximately 80% of all new claims for illness benefits. The use of these guidelines by GPs will get underway shortly on a pilot basis. The outcome of the pilot will be closely monitored, but the aim is to determine if their use can lead to a significant reduction in the progression of acute common health problems to a state of chronic disability and long-term dependence on the welfare system. While such a reduction could in turn, and we've seen some of John's examples there, could in turn help lessen welfare expenditure, the single most important issue here is better health outcomes for patients. In relation then to the musculoskeletal problems, the guidelines also reference the work done a number of years ago by Dr. Leach in the Renaissance project. This project demonstrated that early intervention, where claimants presented with lower back pain, early intervention resulted in a significant reduction in the progression to chronic disability and dependence on long-term illness benefits. And there is, as you can see, an obvious fit between this work and the key premise of the Fit for Work initiative, which emphasised the importance of early intervention. I'm particularly conscious in the debate that sometimes happens between the public and the private sector that the statistics presented for the private sector are often much lower than those for the public sector. So I do think that in each department of government, it's very important that we develop programmes in the public sector which look to take advantage of all of the recent research in relation to either repeated absences or the development of a long-term absence from work. And as I say, this is a cultural shift, I think, both in the Irish private sector and in the public sector, away from the traditional illness concept, sick notes, doctors signing sick notes, or the secretary leaving the sick note at the desk. I think lots of GPs nowadays find that system, and GPs often say to me, it's not what I came into medicine to be doing, to be basically handling sick notes. So I think the work that's been done currently by Dr. Leach and his colleagues, and, as I say, the cultural approach that's been taken by the Fit for Work Coalition, I think it enables us to have a discussion and learn from best practice in other countries about how we can improve our own situation and provide for a much healthier work environment, and for people then who do develop illness or who develop chronic conditions such as arthritis, that there's a supportive and understanding work environment which also assists not simply with immediate medical requirements but also with ongoing therapy. And again, having had an opportunity to look at a number of the case studies, I think it's having that kind of framework that really makes the difference for people and ultimately helps them to get back to work. Particularly, again, going back to arthritis, a lot of younger people are diagnosed with arthritis at a relatively early age. The improvements in drug therapy mean that for a lot of the people nowadays, it is possible to manage the condition and to enable people to be full participants in the workforce and to be financially independent. And I am just, I have to say, determined that the Department of Social Protection should be a partner in the work that organisations such as yourselves are doing. Because while there is a monetary dividend and a financial dividend that's terribly important in the times that we're in, the really important dividend is that people who otherwise become locked out of participation in the workforce and in the wider community, developments like this enable their skills, their creativity, their productivity to be fully utilised, and for they themselves to become full participants, and most importantly, from a personal and a family point of view, to retain financial independence and not simply to go into a situation where they become, over a long period of time, very dependent on state supports. So thank you very much.